Good afternoon, everyone. All right, see some familiar faces here. That's good. Some new faces, some new names. Welcome in. All right. Well, we're going to jump right in. We've got a jam-packed agenda for today. Want to welcome and thank everyone for your continued partnership in this growing network. It was great to see everyone at the in-person celebration last fall. We're very excited to continue the discussion in today's virtual session. For those of you who are new to this group, this work represents a unique collaboration between Renton School District, City of Renton, and then a number of their local and state partners. For today's session, we're going to be reviewing what we accomplished during this school year, 2025-26, as it winds down, and then discuss our strategy going forward for the next school year. In terms of the agenda, we've got a great group of speakers, Renton community leaders here today for the discussion. We will begin today, as we always do, by grounding everyone in our shared mission and vision, and then we'll just spend a few minutes revisiting the challenge that really brought this network together and quickly walk through the Student Health Hub model so everybody is familiar with what we're building here. And then we'll share accomplishments, lessons learned from the year, discuss priorities for next school year, and reserve some time at the end for Q&A and discussion. And you do not have to wait till the end to provide your questions. Please, this is really designed to be a community learning session, not just an update. So we want to hear from you. Feel free to drop questions in the chat, raise your hands, come off mute, throw emojis up there, whatever suits you. All right, Vicki, will you kick us off and remind us of the mission that we're on and our North Star?
Oh, you bet. So welcome, everybody, and thanks again for being here. I am the Director of Student Support for the Renton School District, and I wanted to just thank you again for your time here and to kind of go backwards to go forward. So when we first started looking at this work, it started a number of years ago. Many of you will remember that. And we did a version of a sort of a scan to see what supports were available for students and what we needed. And we began reaching out and seeing what schools had which supports and which partners, et cetera. But what we discovered is that we could really use a more coordinated sort of ecosystem support, because we didn't want there to be, we call it the no wrong door, right? We wanted to make sure that it didn't matter what school you went to or which providers that you knew as a counselor or things like that. If there was support out there available in our community and we knew that the student needed the support, we could connect them to that support. So our idea was to see if we could make sure that all students had access to the services that they need in order to thrive. And so we began these Renton Learning Network meetings, I believe as long ago as like 2022 or 2023, quite a while ago now, and asked you as community providers what you needed, as well as asking our counselors what they needed. And this Student Health Hub became the connective infrastructure that helps put the whole system together so that you can connect a student to the basic needs that they have or to their behavioral health support that they need, things like that. So the reason that I really wanted a chance to talk for a minute, though, is that even though we are still working towards our North Star and trying to continue to fold things in, this already, what you've already implemented as a result of these learning networks and this partnership and the work with the city and Health Commons One Health Port, it has been what we described across our district as a game changer. Students are getting access to the help that they need in a faster way that's culturally responsive to them. We've been invited, and so that's the other thing I wanted to make sure and say is thank you for this too, because we've been invited to speak across the state on what we're trying to do here. And I always feel a little bit like it's unfair that I get to go and talk about it and represent it when I know that you are the ones doing the work and the people that are serving the students. So I also just wanted to say thank you for that, that this connection that we're trying to build with this infrastructure where all students have access to the supports that they need is being recognized, and it's important, and it's changing outcomes for our kids. And I'm excited to share more of what our accomplishments have been this year so that you can see it as well. But I just basically know that we are really moving quicker than we thought towards this North Star, and it's happening. So good job.
Thank you, Vicki. Yeah, this is certainly the ultimate team sport, and so we know it takes all of us working together. And Vicki, we really appreciate you leading the charge here and having us follow your lead. Before we get into some of the accomplishments, we also thought it'd be helpful to just remind folks a little bit about the challenges that this group has come together to address. And for folks who are new to this work, when we had initially started this collaboration together 3 years ago, we as Vicki said, we really found, wow, there's all these different layers of support and service at the local, county, and state level. The challenge really wasn't the lack of resources, but rather the coordination of resources. And I thought it'd be helpful maybe to call on Julie, because I know Julie's one of the school counselors at Renton School District who's been here for a while, and maybe just share a little bit about, from the school counselor perspective, what these different layers of support look like, and what the way that school counselors used to connect folks to services looks like pre-hub. Julie, would you mind taking a few minutes?
Not at all. Thank you for inviting me. I feel really honored to be able to represent counselors, but I know I speak for all of us. It has always been a nightmare to get kids connected to counseling for several reasons. There are very few therapists out there. Once COVID hit, I realized there are so few counselors that help kids under the age of 18. And then there's the private versus the Medicaid insurance. And so counselors, we've always shared our lists of therapists that are, that have that cover private insurance and groups, and how do we refer to this community health agency, and how do we do, we're always sharing lists. It took forever. And time would slip away, and it's taught, you have to get parents interested, and it's just been so hard to get kids connected in the past.
Yeah, that sets the stage. And maybe, here's we'll talk about the Student Health Hub model a little bit, and then Julie, why don't you pick up where you left off and really, explain what that school counselor experience looks like today, now that we've implemented this approach.
It is such a solution. This whole hub has been, there was a pilot last year, which I was not a part of, would have loved to have been, but the minute I found out that we could do it, it is so simple to get kids connected. I have a conversation with a parent. It's also getting parents understanding that counseling is important. And if you started early with your kids, they're just going to grow, and you're going to see that growth. I've referred 14 kids this year, and it is such a simple process. One little sheet of paper, parents sign it. And I usually check by the following day, sometimes same day, that they're already connected to one of the agencies. And as time has gone by, I've seen it's kids are being connected very quickly and talking to the agency. I've noticed as time's gone by, closer to June, some, I just referred a couple, but they're already connected on a wait list. So, it used to be months and months before kids could see someone. The other thing I love, if I'm not taking too much time, is I currently have right next door in our psychologist's office, we have our counselor from Akin, And our connection is akin. I love the connection that I have with the three agencies that are here at our school. We collaborate. We let them know if it's been a rough day or a great day, and then they let us know. They let me know what's going on, and it's just been amazing. A couple of them have wraparound services, and it's all because of this.
Love it. Thank you so much, Julie. And maybe we'll have Lane sort of pick up the baton where you left it off from that school counselor perspective of, meeting with the student and sometimes the family or caregiver, collecting consent, submitting that referral form. And then Lane, would you be willing to talk about the hub manager piece of the process?
Yeah, absolutely. It's really good to see everybody's familiar names and faces. I'm Lane. I'm the Student Health Hub Manager for Health Commons One Healthport. And my primary role, once I get the referral from the school counselors, from Julie, I put the students' information into our Provider One database just to confirm that they have Medicaid coverage and it's active. If they don't, then I'm able to go back to the school counselor and we work together to kind of figure out what is the student's insurance status. And that makes it so that we make the best match to the provider who can accept that student's insurance status. So hopefully decreases sort of that wait time to figure out if the student's eligible in the first place. The second step is I review the referral. We get a lot of information from our counselors about what the students are needing. So I'll check on, student language, of course, the reason for referral, but even down to, students' preferred treatment location. So if they need to be seen at school, if they'd rather be seen virtually, all of that, I kind of look holistically at the student. And then I look at all of the information we pulled from our providers at the beginning of the school year. And by looking at those provider profiles, I'm able to kind of make the best match. It's not always right on the first try, but it definitely lets us get students into care hopefully quicker and a good fit for what they need. So send it off to them, and then the providers have a chance to review the referral and make sure that they also feel that the student is a good fit. So it's been a great year. I've really enjoyed collaborating with all of the school counselors and providers and just appreciate all of what you all do for our students. So hand it back to you, Adam.
Yeah, well said, Lane. And maybe we'll do the baton handoff one more time now to one of our provider organizations, just to talk a little bit about what Student Health Hub looks like from their point of view. I'm wondering, Donna, I think I saw you on the call. Would you be willing to talk about what it's like to receive those referrals and what happens next?
I'm really impressed by the Student Hub. I think that one of the things I've noticed is last year we didn't get as many as we've gotten this year. I think that we're up to about 24 students that we're serving. The thing I like about the Student Hub is that the information I'm getting comes directly from the school counselors about what the students' needs might be. And so I'm able to sort of match that with my clinicians. A couple of years ago, we had very few child clients in our clinic, and so this has been a game changer. So I have two child-focused clinicians now, rather than the one I had last year. I'm looking at building the child-focused team here with the Renton schools, kids coming from the Renton School District. We're also able to now go into the schools and meet the kids where they're at, and that's been a big game changer as well. A lot of the 13-year-olds do not want to come to the clinic, and they want to be seen at their school. And I think that that's something that we'll be able to do a lot more now. We have two of my staff are able to sort of see students in the clinic. I'm really impressed by the fact that this is going to be catching kids early before their mental health issues become worse. It's also a way for us to communicate also with the counselors and hopefully with the teachers. And then with the parents, I think that that's the other thing, is learning from the parents what's going on at the house. We've been able to sort of do a couple CPS reports because we found out that the student was behaving in a way that was reflective of what was happening at their house. The thing I also would say is that, when I see a client, one of the students leave with one of our clinicians, they're happy and they're wanting to see that person again, and that's amazing. And so, to me, this is great. I think that, and Lane, I wanted to say thank you for shepherding me in this and making sure that you gave me all the information and that we communicated all the time about specific issues that we were having. The only issue that I think that we have right now is the 13-year-olds and older who don't want their parents involved. And we're having a hard time encouraging them to show up for appointments, showing up for the initial intake. And I think that that's been sort of the thing that hopefully we will figure out a fix for that. And I think one of the fixes will be that we will be able to do intakes at the school next fall. So that'll be good. So anyway, that's my line. I would say I'm really happy. I'm glad that you guys have invited Valley Cities into the mix. So hopefully we've done everything that you wanted us to do.
Thank you, Donna. And yeah, I know the partnership is greatly appreciated with Valley Cities and all the other providers on the network. I think it's a testament to the unique or sort of special sauce that Renton has to be able to pull these partners together and build this bridge and just make sure that we continue finding ways to make it less hard for folks to get access to these services. Now we get into the accomplishments of the year. Devin, would you be willing to take the lead here?
I would love to. I'm Devin Doherty. I am the mental health facilitator for the Renton School District. So I get to work really closely with our counselors. I get to work with Lane. I get to work with our providers and kind of be the district support person for all of that. The biggest change this year is that we moved from a pilot to district-wide implementation. Every single one of our schools is referring students to the hub. We have 16 partners, which is very exciting. This year was a huge year of growth and maturation of the network. We also, since we partnered with King County SBIRT program in 2022, we've now screened over 1,400 students and referred 410 of those students to services. We also this year launched a housing partnership, a housing hub in partnership with Neighborhood House, which is incredibly exciting because we now, in addition to having this one entry point for mental and behavioral health services, we have the same entry point for housing services, which is incredibly exciting. We are investing in a new infrastructure to support data sharing between schools and providers. I think one of the great things about working on the hub is that it is always getting better, like the internal piece, the infrastructure, the data we're getting, the communication pieces. Like, I feel like every week there's something that's gotten better, and it's so exciting to get to be part of that. We also this year have partnered with Cambria Health Foundation and Oregon Health and Sciences University, OHSU, to complete an independent evaluation of the hub that we'll talk about more later. But I think what's really exciting from a district perspective, like getting to see the whole big picture and all the systems, is that we don't have the question anymore of whether or not this model works. We know that it works. What we get to focus on now is how are we going to sustain it and how are we going to scale it, add more providers, get more students in, add more services. And that's a really fun challenge to have. Adam, do you want to add anything else?
No, you're doing great, Devin. Go for it. Just wanted to say it's been great to have Devin join the team here and really start to grab the bull by the horns. And we're just going to continue to sort of pass the baton to Devin and move into more of a support role to make sure that you all have what you need to help drive the network forward. So, but yeah, go ahead, Devin. Keep going.
All right. Talking about kind of the needs and access trends, None of the behavioral health concerns are particularly surprising. We get to look at, my team gets to look at data from across the Health Hub, from SBIRT, from the Healthy Youth surveys, and we kind of get to look and see at trends across the district. The trends in Renton are really similar to the trends that we see nationwide. We're seeing a lot of anxiety, excessive worry, a lot of emotional regulation challenges, depression, withdrawal, self-esteem, academic concerns, a increase in trauma, and social concerns. The demand is remaining very high, and our providers have really risen to meet that. And I can't imagine that the demand is not going to continue to go up for services. And so it's really so incredible to get to work with providers who are like, yep, we're ready. Bring us more kids. You know, Donna's talking about expanding and hiring more clinicians. And it's just so exciting to have providers who are on board for that and ready to kind of meet the challenges that we have. I think what's really exciting, while this demand is really high, we are able to be responsive to the level of demand and to kind of the through the system that we're using. This year, more than 300 referrals were accepted and matched with providers. Our matching time is around 9 days, which is, if you have ever been on a wait list for mental or behavioral health services, is incredibly quick. There were only 4 students that we didn't have services available for, and which percentage-wise is pretty small, and is also a really helpful guide for us of which providers we want to add to the network. Where are the areas we want to continue to grow? Who are the students we want to expand our services for? And I think this all this data and the data that we're seeing across all of the places that we gather data from is really showing kind of the value of coordinating and simplifying the process, from counselor to the hub to provider, and then being able to have that loop of communication is really showing in the number of students we're able to serve and support. And I think our challenge going forward and going into next year is continuing to match more students and helping them successfully enroll and engage in services, kind of what Donna was speaking to, of, okay, we've got you matched, we've got you with a service. How are we going to make sure that you're at that first intake and that you're following through with services? And if it's not the right fit, how are we going to get you rematched? So kind of getting to focus on that piece of making sure students are accessing our services.
Thank you, Devin. Yeah, great summary of the accomplishments from this year and where we see some of the challenges and need to improve on the behavioral health side. Would love to now pass it over to Brianna to talk about the student housing needs and access trends.
Absolutely. Thank you. And good afternoon, everybody. I'm Brianna Dwyer O'Connor. I am the Director of Housing and Economic Opportunity at Neighborhood House. And we were thrilled to join the partnership this current school year. So back in fall, we started providing services in fall of 2025. This has been a model of holistic community care. Neighborhood House is a multi-service agency, and the housing stability work that we do, we primarily work with families, and we also work with a couple of other school districts. And I've been really impressed about how integrated this model is and the clarity with which we've been able to step in and join the process. We received referrals like I believe week 1 or 2 of when the fall started. So the need is definitely there. Housing instability is a significant and growing student wellness issue. And we know that housing insecurity directly impacts education outcomes, attendance, and mental health. I learned from one of the behavioral health partners that actually what we do is also a form of healthcare. And so we're thrilled to be able to provide rapid rehousing services for families and eviction prevention support. I want to thank the team, most of whom are on the call today, who provide that service directly to families. To date, we have at least, I think it's grown now since these numbers were printed on the slide, but referrals that came in were 73. This district was able to match to us, and we were, so far we have enrolled in services 49 students and families. We have seen 19 evictions prevented. And at least we are up to 6 families moved into permanent housing who were otherwise unhoused or living in a not suitable housing. We are seeing families who are doubled up living arrangements in temporary shelter, some families staying in hotels and other spaces, and many families at risk of eviction. I think it's about half and half about in terms of the referrals that we're receiving where families are currently housed but are at risk of losing that housing due to eviction, and those who are in an unhoused situation, whether that's doubled up in a vehicle, in hotel or shelter, or other unstable situation. So we're really seeing this as this holistic whole child approach. The connection has been very efficient and coordinated. So we were able to really start off providing the services directly right in the fall, and been able to kind of keep everybody in the loop and build a strong partnership swiftly with the district, which I really appreciate, so that we can ensure the best service for students and families.
Thank you, Brianna. Yeah, and just to do a little pre-post comparison. And maybe Vicky's going to do that for us. Yeah, Vicky, I'd love for you to talk about what the experience was like before we had this process and the partnership with Neighborhood House.
Yeah, I just wanted to thank Neighborhood House and everybody on the call who thought of adding this to the hub, because the McKinney-Vento, which is the law that supports homelessness and education, that particular work moved under the Student Support Department a year ago. So I was still pretty new to it a year ago, but I would get phone calls from families who would say, I don't know what I'm going to do. My child is struggling because we're about to lose our home, and I know that my son, it happened more than once. They would just tell me these horrific stories, and I didn't ever want to interrupt the story because I knew that they were sharing it and wanted to be heard, but I also didn't have a solution. And so I could say, well, I can send you a list of resources. And they one time even told me, well, actually you were the name on the list of resources and we just really need help. and I'm like, oh my goodness. So I would hear these stories and not have anything I could do. And I mean, not that this is about me, obviously, but the fact that now there's a different answer than let me hand you a list is just beautiful. And I just want to thank Neighborhood House and all of you in the city for being a part of thinking that through for us, because the number of families that are now, I get quotes and things like that from people that say everything has changed for this student. And because the family is no longer afraid, the mom, for example, has been able to go back to work, and now the student's attendance is better. And I mean, the idea that it's a wellness and educational intervention, I couldn't agree more. So thanks for letting me jump in.
Thank you, Vicki. And I do want to also add, you reminded me, I've had the pleasure of meeting at least 2 of the parents that we've been working with too, who are engaging also in our employment and training services. So parent is going back to school to get a certification. We've been able to kind of lift some of the pressure because we're supporting with the housing so that they can do that. And we're helping them navigate funding so they can go back for free, and working back with RTC on some opportunities. And then another parent is participating in a program that's, I think it's an incentive-based employment program to just find their next career path. So that's been great too, because we can also wrap around the other support that we have available at Neighborhood House. So thank you.
Yeah, just an amazing partnership. And Neighborhood House has been doing this partnership with other school districts in King County, I think for like over 7 years now. So it's just been great to see all the learning and knowledge that they bring to serving students and families, through the school district, and seeing this come to life in Renton through this integrated approach. And we're going to go from talking about what's happening at the service level to now dropping to what's underway more at the technology level. So Hannah, will you kick us off here?
Sure. Good afternoon, everyone. I'm Hannah Rapp-Brown. I'm with HCP1 Healthport. And yeah, really excited to share some updates here today. As you know, right, as a network, we move closer to our shared vision when we advance projects that help connect the right information to the right person at the right time. Thanks to funding from the City of Renton, the Renton Impact Fund has been able to partner with 3 behavioral health organizations on innovative projects really designed to strengthen the connections between Renton students and families and the services that support them. While each project is unique and you can kind of get a flavor for each of them here in the table, they do share some common goals around strengthening patient and family engagement, expanding provider capacity, which is so important, and improving access to health information and care coordination. I do want to spend just a few moments highlighting one of the projects because I do suspect the challenge being addressed will sound familiar to our other providers in the room. In partnership with Valley Cities, we've been working with a number of Donna's colleagues to co-design a solution that will really enhance the team's ability to manage Renton Student Health Hub referrals into the electronic health record. So the goal is really to reduce the manual steps, the administrative burden that's associated with referral coordination, expedite referral review, improve accuracy of information into the EHR, and really create a smoother experience for our providers. Like many providers, and as Donna shared, right, Valley Cities is navigating the challenge of managing referrals from many different partners using different systems. And so we know these challenges really are not unique to Valley Cities. They're experienced by many of you here today. And so we really think this work has the potential to have a broader impact with some of our other providers. Donna, I saw your hand come up.
Yeah, I just wanted to say, I've been talking to Nicole Penman, who is our, and she's pretty excited about managing this and making sure that everything is smooth for our response every time we get a referral. So I'm excited about that.
Thanks, Donna. Yeah, exactly. Our goal is to make it easier, right, for our providers to coordinate this work, less manually intensive. So although we're still working through the details, the workflows, we're really excited about the progress and the potential impact. So we're interested to hear from our other providers here today if you might also be interested in a similar solution. So ultimately, right, projects like these, well, it appears like they're very much technology focused. They're really more than technology. They're about strengthening the connections between schools, behavioral health providers, community partners, and the City of Renton, our local city government, so that together we can really create a more coordinated system of care, better outcomes for our students and families. And as you all know, this work is really hard. And I just want to recognize and thank our providers for the relentless preparation, the coordination, the evaluation that they've done to really ensure that these investments have a significant positive return for the Renton community. So, Adam, I'll pass it back to you.
Yeah, thank you, Hannah. And it's exciting to see these local initiatives underway to improve interoperability and reduce the workload of coordination for our providers. At the Renton level, we're also seeing this effort across the state in a number of different areas. So it really aligns with where I think the state and the federal government is headed in terms of helping make sure that we can coordinate these services more seamlessly. All right, and now I'm going to pass it on to Dr. Brian Frank. If you're on, would love you to talk a little bit about the partnership between Oregon Health Sciences University and Cambia Health Foundation and the network to do an independent evaluation of our work here.
Yeah, great. Thanks, Adam. Yeah, I was excited to be a part of this. So by way of background, I'm a family medicine doctor and a researcher at Oregon Health Science University. And my research centers around health equity and interventions that improve the health and well-being of populations. So we were asked to do a formal evaluation of this project because it's all well and good for Adam or someone else at Commons to say that this works well, but it's not quite as exciting as if an independent evaluator does the same thing. And so our team did interviews with a number of folks involved in the project, both on the team and on the ground, to get a clearer sense of the benefits of the project. We also crunched some numbers. And I can happily report that everything that everyone has said so far is statistically and factually accurate. That's my job today, is to let you know that statistics and facts are also correct. This is everything that you've heard everyone say. This is making it easier to refer kids to needed services, and that's really the goal, right? To decrease the burden for getting folks enrolled in the services they really need. The referral to enrollment time dropped markedly. The school staff found that there was a significantly decreased burden in the referral process. Access for culturally and linguistically diverse families improved, and it continues to expand, which suggests that the scalability is reproducible. I think this is really exciting. I think there is more research that could be done to evaluate the longer term impacts of this model, but I think it's something that really needs to be highlighted and celebrated and reproduced, certainly throughout the state, if not throughout the country. So it was a real honor getting to work on this project, and thanks, Adam, for involving us.
Yeah, it's been a pleasure to work with your team, Brian, and really appreciate the thoughtfulness that you all put into the report. That's something we can certainly send out to folks if you're interested in taking a look at it. But it's a nice body of work, and I think definitely reflective of the incredible collaboration across the partners here. So much appreciated.
Adam, I will add just a thanks again to Steve Lesky and the folks at Cambia Foundation for making this evaluation possible as well.
Yeah, it's a great call out, and actually a great segue. We're going to have Vicki and Mary Jane Van Cleve from City of Renton talk about where we're headed next. Part of which is continuing to figure out how we bring a diverse set of funders to the table to support growth and expansion of the network. But Vicki, why don't you kick us off from the school district point of view and talk about where things are headed, and then hand it off to MJ to talk about where we're headed from the city perspective.
Sure. So I'd say the number one most important thing is that we can't go backwards. So for me, the most important thing is that we figure out how to sustain the services so that all of our schools continue to have access. So my first wish, dream, hope, etc., is that we make sure that the process, the product, the systems, all of it maintains first. And then, so to that end, whatever you need to do to reach out to, your legislators, anybody, let the world know that this is working and that we need it to continue. But then in order to, you met Devin earlier today in our conversation. In order to help with some sustainability, we are taking on the hub manager position here at the school district. So it will be, Lane, you have been amazing. So this has nothing to do with not wanting you, but it will give us the chance to have somebody embedded in the district meeting with the counselors and helping with the matching and reaching out to the partners. So we're going to take on the hub manager position. And then we are very excited. So some of you are represented on this call. That, remember, I mentioned earlier in that sort of no wrong door, North Star vision, that one of the things that started the whole process was a scan of the supports that we had across our schools and the look at some inequities in who had access to what. And the thing that came out loud and clear at that time was not just behavioral and mental health supports, but mentorship supports and other types of connections to services. And so we're exploring how do we add some of those others so that the people who are doing our current referrals can refer to something more than, not that it's not great. We love being able to refer to behavioral health, but we also want to be able to refer to mentorships or activities or things that are also going to increase the wellness of our students. So we're looking at exploring what would that look like and how can we add things like that to our hub. So those are sort of my exciting things that I wanted to add.
MJ, can we hand it over to you to talk about where we're headed?
Absolutely. But I do always have to start by saying thank you to Vicki. She's been a huge inspiration and a reason the city is partnering. So this has been a multi-million-dollar investment from the city, and incredibly thankful to the council and our mayor for supporting this. However, I will say we are in a challenging time and sometimes in moments where we do have competing priorities. So back to what Vicki was saying is if you're a Renton resident or you have connections to Renton, please continue to thank the council and let them know this is one place you want to continue to see funding provided. Because the council ultimately approves our budget. And so I am always grateful when they support our initiatives that are brought forth by city staff. The reason we're involved, I oversee the Department of Parks, Recreation, and Human Services as a division within our department. So we're connected from a multitude of ways. For us, we see these as our children. These are our kids that are in our programs and in our services. So where we're going is seeing where this model has been successful. Within our department, we also have a senior center. There's a huge opportunity to replicate and connect a similar format for our senior community. We have one of the most highly visited senior centers in our region, and a lot of adults need help guiding all the resources and services. It is complicated and fragmented, and as you get older, it seems to be even that much more complicated. We also have adult children looking for help on how to help their parents. We have grandparents caring for grandchildren and raising grandchildren. So the era of how people age is very complex and very different. It's a huge spectrum. Our senior center serves as young as 50 and as long and as healthy and vital as they can be. So can anywhere be from a 40 to 50 year span. That's massive. So we're learning a lot from this network, and the intent is to figure out how to continue to promote this as a wise investment for the city and for the business community, and where can we bring in all sorts of partners and philanthropic opportunities to braid our funding, to leverage our funding, but just to build on what we know is successful. So I think the study that was done just continues to add to the credibility. And thank you to everyone who makes this just an amazing network. And thank you to Vicki.
Yeah, and huge thanks to MJ. Your leadership here, same as Vicki, is just none of this happens without leaders on the ground that want to grab this bag of rocks and carry it up the hill, because this is not easy work, to build these partnerships and build these networks. And it's something new. I mean, we are seeing across the state, across the nation, people move towards this network model. It's other industries have done it, finance industry, energy industry. It's time for health and social care to move towards these networked models, but it takes a lot of courage to go first to do this, and Renton is going first at the local level. So we just continue to be the biggest cheerleaders for this group to just keep going, because other groups are going to head this direction. And we can now really open it up for discussion and Q&A, some sample questions to throw out there for folks to chew on. What priority needs are you seeing in the community? What are the gaps in our current hub services? Where would you like things to grow? Do these strategic priorities that MJ and Vicky have laid out make sense? Would love to hear from you. Go ahead, Donna. Thanks for speaking up.
I think one of the gaps is getting the school counselors to understand who we are as providers. And I was mentioning this in a meeting recently, that perhaps we can do some sort of open house with the school counselors so that they can see the faces behind the services. And then also maybe do an open house at our clinic for the school counselors as well, because I think it's really important that they know what we do and where we're at.
Yeah, I love it. Love those ideas, Donna. And I think we're at least from the digital perspective looking at ways that we can continue to elevate the provider profile of Valley Cities and the other providers on the network, to make it easier for folks to understand, these different agencies and the services they provide. I see in the chat Alana describing that food nutrition education is certainly an area of potential growth that I think kids and families would benefit from, as MJ thinks about the senior population. That's certainly something that would apply to that population as well.
Hi, I'm Sherry. I'm at Sound and I'm down in Auburn. And I just think what you're doing in Renton is fantastic. I live in Renton, and so I am so supportive of all of this. So I definitely will make mention this to my mayor and council to make sure that they still fund this, because this is fantastic. My question is, I had been part of a conversation maybe a year or so ago about maybe Enumclaw being part of the hub, and I don't know if we dropped off of it, or if Sound isn't part of it, or if it didn't work in some way, because I never really heard. And so I was wondering if that or any of the other districts down here, Kent, Auburn, Federal Way, Tahoma, any of those were potential for this program.
Yeah, great question, Sherry. And just to first thank you and thank Sound, because you all were part of the initial 3 provider organizations that help with the co-design of the hub, and have been an incredible partnership with Sound throughout the work. To answer your first question around Enumclaw, we did initially start off with a pilot test period in Renton, Seattle, and Enumclaw. Renton is the only community that's gone from pilot to scale. Seattle is pilot testing, still in 5 schools, making some progress there. Enumclaw, after our initial pilot test, we ran into some technology barriers that we couldn't overcome today, and so we had to sort of put that pilot test on pause while we continue to see if we can address that issue. But it's certainly a community that we would like to continue to work with and serve. To your second question, there is interest in replicating the Renton model in other communities across the state, but particularly in King County. We may have some folks from Kent on today. I know they registered, or other communities, if you want to chime in.
Just Elisa from Kent School District. We're very much in the exploratory phase, just asking questions, talking to folks internally and externally, and just looking at, what might be the best fit for our structure, our district, and our community. Yeah, so evolving.
Yeah, thanks for coming off mute and sharing a little of your thoughts. I know, I think either Delaney and Margaret are from the county as well. Maybe you all could share what you're seeing at the county level.
Hey everybody, Delaney Not Nearest from King County. I'm the school-based SBIRT program manager, so I currently oversee SBIRT implementation in all the districts that are participating. And I guess what I can say right now from the county level is that transitions between organizations is a very key and important topic that's been brought up in several implementation plans. Just because I think we all know here on the call, just as Vicki outlined in her story, it is very frustrating to be handed a list of supports and have to call through it and not know when it was last updated and who are you going to get on the other line and things like that. So I think the Health Hub has really been a solution to that frustration that many people have been feeling. So that I can see that that is a big subject of discussion right now in the county. As you all may or may not know, there are several funding streams and levies that are going to be up for renewal. So it's definitely a conversation that is happening. So I can share that piece. And obviously so thankful for all the work that you are doing and connecting all of this. It's been so cool to see it come to fruition after all of these years. And I was talking to Vicki and Devin recently about how my dream is that the hub will have so many different things. I know you all are considering mentorship, but the fact that we added housing and all of those things, so that can really be this resource place, not only when things are not going maybe how families or we would like them to go, but for when things are going well, so that can continue to go well. That really promotion and really uplifting because we know that'll help when things maybe might not be going so well. But I just think that's fabulous. So that was just off the cuff response. So, but thank you all.
Yep. That's what we love. We love the off the cuff response, Delaney. So really appreciate you and definitely want to pay gratitude to King County's leadership, doing all the development and implementation work of the school-based SBIRT model, because really without that foundation, we wouldn't have been able to come in and support the city and the school district and their partners in trying to crack this referral to services challenge. So it's like all things, this is really the ultimate team sport to be able to do this, and it's going to take all of us continuing to work together to grow and sustain this work. I know we're pretty much at time, so I'm going to wind us down. We do have a follow-up survey, which I'm going to drop in the chat. Would love to hear from you, just some feedback around how this session went. And we'll send that out in an email here shortly. But yeah, just really want to close by expressing gratitude again to folks taking the time to come together, twice a year to celebrate the accomplishments. Continue to do all the great work. You'll hear more from us soon. Enjoy the summer, and we'll look forward to reconnecting next year. Thanks, everybody.
Thank you. Have good days.